We go to our nation's capital now, where the Biden administration has named 10 prescription drugs it hopes to make cheaper for Medicare recipients through negotiations with drug companies. The White House says the drugs on this list include Jardiance for diabetes and the blood thinner Eliquis. More than 60% of the 65 million on Medicare take prescription medication, and 25% take at least 4 prescriptions. That's according to KFF, a healthcare policy organization. We get more details on this from our Ed O'Keefe.
Catherine Bristol says she sometimes has to choose between buying groceries or her diabetes medication, which can cost up to $200 a month.
I shouldn't have to choose between my medicine to keep me not going blind, not eating, or dipping into my rent.
The drug Catherine is using, Januvia, is one of the 10 chosen that could see prices slashed in negotiations between the government and drug manufacturers. About 9 million seniors in Medicare's prescription drug program used one or more of the drugs last year, paying $3.4 billion out of pocket.
This is a long time in coming.
It's the U.S. government's strongest ever attempt to tackle the high cost of prescription drugs.
We're going to keep standing up to Big Pharma, and we're not going to back down.
If drug companies refuse to negotiate, they'll face new taxes or be forced to withdraw from Medicare and Medicaid. The industry's top trade group hit back, saying the plan is focused on short-term political gain rather than what's best for patients. But in the coming years, additional drugs are expected to be chosen for price negotiation. Wall Street analysts say one could be the popular drug Ozempic, used for weight loss. Savings for the 10 announced today won't come until 2026, but for Bristol, it'll be worth the wait.
It would be very helpful. I don't have to choose then. I could go straight and get that medicine if the price go down.
And Ed O'Keefe joins me now from outside the White House. Ed, this isn't just a health care policy from the Biden administration, it's also a budget policy.
Absolutely. In fact, it was one of the big reasons why they wanted to get this finally passed after decades of fighting for it. The estimate is that by 2031, if these negotiations continue and prices continue to drop, Medicare is going to see at least $25 billion in savings every year. That's a decent, chunk of change for the federal budget. And ultimately, the hope is that they can cap everyone's prices for drugs every month at about $2,000. So you're going to see a personal significant savings as well. But, it's also good politics. Majority of Americans have said in polling for years that the federal government should be able to do this, even though now at least 6 of the drug companies and their trade group, Big Pharma, are suing to stop it, suggesting that Medicare and Medicaid don't necessarily have the authority to negotiate this on their own with the companies.
A big fight for the incumbent president during an election year is the second best thing to getting it actually passed, I suppose. Ed, what is the chance that all of this is just negotiation, that the drug companies and the administration will eventually resolve things, and that this is really all, this impasse at the moment is just jockeying?
I mean, that is a big possibility, or that all of these lawsuits essentially get merged into one big one, and at some point some federal judge or the Supreme Court weighs in and says, no, this kind of thing is possible. Remember, we've seen years of legal fights over changes in healthcare policy related to the Affordable Care Act. In this case, the Biden administration, and it's the changes supporters on Capitol Hill believe they're going to withstand legal challenge because Medicare should be able to do this and has the capability of doing so. The other thing the White House signaled today is once the price changes are announced roughly this time next year, the hope is that private insurance companies will see the change and say, okay, well, if Medicare is going to offer it at that price, we probably should too. And then market forces ultimately may help drive down the cost of prescription drugs for everyone.
Ed O'Keefe at the White House. Thank you very much, Ed.
Take care.